Hello, greeting. My name is Tasfai Haile. I'm gonna present the final project of Fundamental Principle of Population Health Informatics course about innovative technologies that enable type 2 diabetes self-management proposal called Diamedy. Diabetes is a devastating chronic disease. Numerous people are disabled and dead due to the complexity of the disease and its management. The existing traditional diabetic prevention, evaluation, monitoring methods does not adequately address the preferred goal of blood glucose range and A1C target. If at all the patient gets opportunity, he or she tests the blood glucose 2 or 3 times per day, leaving the rest of the day unmeasured, and gets the insulin bolus dose prescribed on trial and error method during in-person visit to be injected 2 or 3 times per day. The level of blood glucose level looks a sort of roller coaster type trend due to this management style. This type of treatment neither controls the blood glucose nor delays the complication. The project aim is to optimize diabetes treatment and avoid related complications. The target audience are diabetes type 2 patients above 18 years old taking diabetes care in Casey Neighborhood Health Center in Alexandria City, Virginia, a non-profit federally qualified health center. This setting was selected because the health center serves patients with low socioeconomic status. Most of them are uninsured, whose blood glucose level and A1C are often uncontrolled. For the pilot project, 10 to 20 diagnosed type 2 diabetes patients without complication and willing to participate and sign consent will be enrolled. Since the device proposed for type 2 diabetes needs care by the patient, the age limitation is above 18. A memorandum of understanding will be signed with Alexandria Public Health Department and Casey Health Center to accomplish the project. To achieve the goal of well-controlled diabetes blood glucose, the following Diamedy technology components are manufactured according to the specification and be ready before the launch of the project. Real-time continuous glucose monitoring, an artificial intelligence-guided insulin pump, a smartphone. A smartphone application were created for this task, Bluetooth technology on the device to communicate with each other, and artificial intelligence technology for real-time data analysis and execute the order to insulin pump to administer the necessary amount of insulin accordingly, internet for message or data exchange between the application and providers electronic health record. These technologies components work as a unit. Real-time continuous glucose monitoring helps measure real-time blood glucose values for better treatment decision. A smartphone application connected to the real-time continuous glucose monitoring and insulin pump by Bluetooth helps the management coordination. The application alerts the patient if attention is needed and can send the data to electronic health record to facilitate patient providers monitoring. The real-time continuous glucose monitoring machine is inserted on the safe side of the patient's skin to measure the blood glucose level and feed the result to the application and then to artificial intelligence. The artificial intelligence analyzes the aggregate 5-minute blood glucose data, and if above the anticipated level, gives the order to the insulin pump to precisely inject the necessary amount to bring the blood glucose to the normal range calibrated during setup. This function happens continuously over 24 hours of the day. If there is no alert from the application, the patient focuses on his or her daily activity. The provider gets real-time data from electronic health record to give feedback remotely and decide, if necessary, in-person visit appointment dates. Data sources are real-time continuous glucose monitoring, mobile application, artificial intelligence, electronic health record. The team involved for the successful implementation of this project, myself for the coordination and quality control, physician for the healthcare service and follow-up, nurse specialized in diabetes for patient education and advice, receptionist for paperwork and patient guide. The outcome anticipated from this innovative technology is avoiding diabetic complication. Resources needed are real-time continuous glucose monitoring, insulin pump connected by Bluetooth with a smartphone and a smartphone application, internet, and the rest. The project uses the health center resources and professionals without additional costs as per Memorandum of Understanding with Alexandria Health Department and Casey Health Center. I thank you.